Really appreciate you taking the time out to discuss this important issue that's facing many of our physicians and patients and hospitals throughout our state. The way we have this morning or this afternoon organized is we'll have three people give brief statements, and then we'll be open to questions at the end if that's okay. I'm Michael Ramsey, past president of the American Academy of Pediatrics Alabama chapter and a pediatrician here at Dothan Pediatric Healthcare Network for the past 19 years. Dothan Pediatric Healthcare Network is one of the largest providers of pediatric health care in the state of Alabama. In 2015, with 14 physicians and 5 nurse practitioners, our clinics in Dothan, Eufaula, and Enterprise had almost 120,000 patient encounters to over 32,000 unique patients. With our service area of 50 miles from Dothan, approximately 58% of our patients are insured by Alabama Medicaid. Since 1953, we've continued to expand our services to try to reach all the children of the Wiregrass area, most recently by opening another satellite in Ozark in January of 2016 and bringing on board 2 new physicians, Dr. Allison Walker in Dothan and Dr. Nola Ernest in Enterprise. Alabama Medicaid primary care parity rates were put in place in 2013 as part of an effort to support primary care practices in order to increase access to care. For the first time, Medicaid rates in Alabama were increased to Medicare rates for pediatrics, family medicine, internal medicine, and some obstetrics. Medicaid assured these providers that they were committed to continuing these rates and that they were vitally important to supporting providers who took care of our most vulnerable populations. Today, August 1st, after 4 years and repeated reassurances to their commitment to primary care, those rates have been cut back to previous levels first established in 2006. With less than 30 days notice, practices like ours are faced with a 30% loss of revenue from Alabama Medicaid. For our practice, this means an immediate decrease in cash flow of $140,000 per month, money that's used to pay salaries, health insurance premiums, rents, and pay for vaccines. Given the increase in labor, health insurance, computer, taxes, and other costs, if there's any business that can operate on revenue levels from 2006, I'd love to see it. We've had to take drastic steps to try to accommodate this change. The most devastating measures included layoffs of 10 jobs and suspension of a contract for a new nurse practitioner. These were 11 valued employees who provided meaningful services for our company, people who came to work on time and did their jobs well, and people who now lost their jobs here due to no fault of their own. We found out today that we've had 2 further resignations from our staff for fear of further layoffs. Most of these jobs were with our clerical staff, the people who help make appointments, who check children in, who help get forms out to schools and places of work. And without these employees, we can no longer run at full efficiency, and all of our patients will have to wait longer for services. Even so, with this 10% reduction in our workforce, we can only make up 30% of these revenue losses. Our clinic performs many services behind the scenes for our patients. We produce almost 15,000 blue slips per year so that children can have immunization documentation for school and daycare. We make 15,000 referrals to specialists every year, a process that requires 4 full-time employees due to the time involved in documentation for insurances. And in addition to our face-to-face visits, we provide telephone nursing advice 24 hours a day, 7 days a week. With this reduced staffing, everything will take longer to complete for every patient, regardless of their insurance. It'll take longer to check in for appointments, extending the time patients spend in our office. We anticipate that our wait time for form completion will go from 5 days to 10 days. Questions about insurance and payments may take several days to research. And currently, typical notification for specialist referrals are between 1 and 3 days, and we expect this to increase to 5 to 7 days. After the back-to-school rush finishes this month, in September we will begin charging for form completion to cover this employee time, a first for our practice. We've been spending hours meeting and planning for these changes, and we still can't do enough to fill this void. If in the next few weeks, we'll have to discuss possibly further layoffs, benefit reductions for our remaining staff, and whether we can afford to keep our satellite clinics open. With 78% of newborns from Southeast Alabama Medical Center and 57% of newborns from Flowers Hospital being on Medicaid, the patient demographics for our practice are unlikely to change in the near future. We're committed to our current patients, and we're doing everything in our power to prevent any change in clinical services. but we will have to consider whether we are able to continue taking new Medicaid patients to our practice. Most people rally for children's causes, but if things don't work out and they end up getting hurt in the end, there's little consequences for lawmakers and state leaders because children can't vote. Today's devastating cut has created an instability in the pediatric healthcare marketplace. The constant assault on Medicaid funding from the legislature that has escalated over the past 2 years has exhausted even our fiercest child advocates. The governor's reduction in payment to pediatricians, family physicians, and internal medicine as a first measure to fill less than 18% of the $85 million shortfall in the Medicaid budget has shaken the confidence that providers need to move forward with their business plans. The Developing Regional Care Organizations, a Medicaid reform plan created by the legislature that had been on schedule for implementation October 1st, has been put in jeopardy after 3 years of planning and development. The upcoming special session not only needs to fill this year's budget hole and address funding for the future, but also needs to reassure providers that this will not happen again. I received an anonymous letter recently that said that the writer wished that I would, quote, "shut up talking about Medicaid." I would love to do nothing more. We have dedicated our lives to the well-being of children, and this foray into the political system does not come naturally, nor is it something we seek. But if all of you could see what we see every day, the children who truly need us and who have families without means or influence, you'll understand why we cannot and will not stay silent. Therefore, we encourage everyone to visit IamMedicaid.com to contact state leaders to encourage and protect Alabama's healthcare system by fully funding Alabama Medicaid.